Okay, good afternoon, everyone, and welcome to our Meet the Changemakers event. Thank you for joining us in this session. My name is Bernd Meyer. I'm the Associate Dean of Graduate Research for the Faculty of IT, and I'll be your host for the next half hour or so. Let me begin by acknowledging that we're meeting today, or at least that we're hosting this meeting from the land of the Wurundjeri and Bunurong people of the Kulin Nation. And I would like to ask you to join me in paying respects to these traditional owners and custodians of the land and to their elders past, present, and emergent. This session is really about showing you some of the breadth of the research that is conducted in the Faculty of IT, some of which you may actually not be expecting when you think about traditional IT research. We pride ourselves on the broad spectrum of our research, and while we certainly have world-leading research in core fields such as artificial intelligence, data science, software engineering, computer science, we also have outstanding and exciting research in less traditional areas and at the intersection with other fields. And this is what we want to give you a glimpse of this afternoon. Our speakers, some of our PhD students, were invited today to show you the breadth of this research, and because they embody our core mission, to use and create innovative ideas in the service of social good. Before we start, a few quick bits of housekeeping. We will be recording the session today. You won't be able to mute yourselves, though. Your microphone is currently on mute, and this is a webinar, so your video feed will not be visible in the recording. If you have any questions, please pop them into the chat window. We will try to answer them from there or forward them to the presenters as much as possible. After the event, if you still have questions, which you hopefully will, go to the graduate booth within the exhibition hall on vFairs, and we can answer your other questions there. And you can also experience the AI mirror ritual, which you will learn about in a second, for yourselves there. And you can see replays of the PhD projects. Finally, you may have some questions about the impact of the current COVID-19 situation on university operations. The university has put together a whole website on this, and we would like you to check that website first, and the fact sheet's there, as we hope most questions will be answered there. So, without further ado, let me quickly introduce you to our speakers who will present their work that they're conducting in their PhD studies. So first of all, we have Nina Rajcic. Nina works at the intersection of art and AI, exploring new forms of effective interaction with humans or between humans and machines. Her work focuses on the critical role that languages takes in framing emotional experiences and memories. And the work that Nina will be presenting is Mirror Ritual, an AI-driven installation that invites you to experience this in the personal context of your own emotions. And while many of you may initially not have thought of projects like this when thinking about IT, the Faculty of IT has a whole dedicated lab working at the intersection of art and IT, and that's the Sensi Lab, where Nina works and studies. So Nina, over to you.
Hey everyone, I'm Nina, and I'm currently doing my practice-based PhD at Sensi Lab. It's at the Caulfield campus, and I'm in my second year of study. So the project I'm going to talk a little bit about is Mirror Ritual. I might start with showing a video we made about it earlier this year. So let me just get this playing. I'm Nina Rajcic. I'm an artist and researcher working at Sensi Lab in Melbourne, Australia. Mirror Ritual is inspired by the theory of constructed emotion. So as the viewer approaches the mirror, it reads their emotional state based off of their facial expression and then uses that to generate a unique poem just for them. We used a neural net model and trained that on a custom corpus of text, including things like horoscopes, some postmodern poetry, some philosophical writing, kind of all geared towards my tastes, I guess. In the mirror, we're using existing emotion classification techniques, but it's not in an attempt to actually measure or accurately predict somebody's emotion. Instead, it's meant to provide prompts and kind of conceptualizations that allow the viewers to reflect and be introspective about their emotion. And in that way, what I hope to do is create this kind of co-construction between human and machine, co-construction of emotion. So when we first developed the mirror, we ran a few preliminary studies into how people engage with it. I think the most interesting thing for me that I found was the way that people interpreted the poetry and how they actually applied that into their own life. And to me, that was kind of an example of how we actually need the viewer to kind of bring that poem alive when you have AI-generated poetry. But in Mirror Ritual, it's meant to be a critique on, the current existing emotion classification technology that's being implemented everywhere. According to the newest science that we have today, it's not actually particularly feasible to read emotion just from looking at somebody or measuring, biofeedback. So I guess I want people to use the mirror and think about those ideas as well. We're currently in the development process of the new iteration of the design, and with this new design we're hoping to just keep testing it and iterating it and seeing how people use it in the future. I think definitely where I started with this work was how do we do co-creation between human and machine. The mirror ended up being a good example of that, where the mirror presents a generated poem, but only with the viewer's kind of emotional input, but also that their interpretation of that poem, that's how it actually becomes a fully fledged poem. That's how I see it. All right, let me stop. Okay, sorry, it took me a second. My work has been so far a practice-based PhD, which is a little bit different from a traditional PhD. And I think that's been a really great experience for me, as it allows me to put a focus on creating and testing out ideas and allowing for that process to continuously inform the theory behind my research, which is pretty fun. I like that way of researching. And the mirror is the first project I worked on at Vagina Lab. And at the moment, and now I'm refining the ideas behind it, as well as working on some new projects that expand on that original idea. So one example of that is that online version of the mirror, which is part of Monash Open Day. So yeah, I urge everyone to go and check it out if you haven't already. That's all. Maybe I'll leave it for everybody else now, so not run over time, but thanks everyone.
Thank you, Nina. Sorry, I had to quickly unmute myself there again. So I'm sure you will all have quite a few questions to Nina. And if you can please pop them into the chat window, and we'll try to bring all the questions together at the end for a little bit of a panel discussion, if that's possible. So for now, in the meantime, we're moving on to another presentation quickly. Thank you, Nina, again. We'll see you in a second in the panel at the end. The second one is Jigya Hetige. And Jigya's project and contribution is actually extremely pertinent in the situation that we currently find ourselves in. Jigya works on applying machine learning to improving healthcare, specifically to predict medical risks and for the early detection of diseases, and also to better allocate hospital resources. That this is really valuable work with real-world impact has been acknowledged in a number of prizes and publications that Jigya has already received for her work. So over to you, Jigya, please tell us about it.
Yeah, thank you, Bernd, for the introduction. And to begin with my presentation, I will share my screen. So hello everyone, I'm Jigya from Faculty of Information Technology at Monash University, and my PhD project is patient readmission prediction with artificial intelligence. So I'm predicting when will it happen and what will happen about patient admissions. So a little bit about me. So I obtained my bachelor's in computer science engineering, and I started my PhD back in 2017. So I'm a final year PhD student. So my PhD study is funded by Monash Institute of Medical Engineering, and I work with Monash Health Hospital in Clayton in predicting future medical risks of patients, as been mentioned, and we use patient admission records. So our motivation behind this study is basically that the clinical staff has to make very important decisions about a patient at the time of discharge by considering several factors, including the medical condition of the patient and also the medical history of the patient and what will happen in the future to make a decision. So our motivation is to build an AI model which can assist the healthcare staff by predicting when will the patient come back to the hospital and what will happen to the patient in the next admission, what diseases. Therefore, the staff can easily and effectively make decisions about the patient's discharge process and intervention strategies to make sure that the patient has a smooth recovery process after the hospital stay. So now let's look at our approach in a big picture. So we have a set of patient admissions, which is in a format of a table. So we feed these data into our AI model, which processes the data and produces outputs on when and what predictions about the next admission so that this can provide a signal to the clinicians on the patient's next admission. So behind this complex AI model, we have neural networks and machine learning algorithms used in several components. So these components are our major research contributions to the field of computer science. And we published some research articles about our research at several conferences. And our medical research was also featured on Herald Sun newspaper. And if you are interested in our work, you can read more about it in these articles. So in addition to these research contributions, our ultimate objective is to basically give back to the society by helping the hospitals to save lives by prioritizing high-risk patients and better allocate the limited resources at hospitals, especially in uncertain conditions like this COVID impact. And also to reduce administration cost, which is involved with readmission penalties induced by the governments. So also we want to improve the quality of life of patients by facilitating personalized healthcare and early detection of diseases. So the next steps would be to improve the interpretability of our AI model so that in addition to the when and what predictions, we will answer why will it happen as well. And also to deploy our model in a real world hospital environment so that we can predict readmissions and medical diseases. Also, we are currently communicating with insurance companies to see how we can improve their risk prediction task in terms of health care analytics. So that was a brief introduction to my research at Monash Faculty of IT. And thank you very much for joining my presentation. And I'm really glad that I could share my experience at Monash with you. So let me... Yeah.
Thank you, Berg. Yeah. Well, that was a very brief introduction, obviously only to quite a complex project. Well, one of the things that I find really interesting about that is that it's embedded in so many different contexts, from hospitals to insurances and so on. You know, certainly all of that makes for quite a different kind of PhD project. And just a reminder to all of you in the audience, it's perfectly fine. So ask questions about the projects, that the technical aspects that you might be interested in, but also this is obviously for you to see how PhDs actually function at Monash University. So also feel free to ask questions for the end about how these projects actually proceed and so on, and including about, I guess, the experiences of our panelists. So just a reminder, pop them into the chat window, whatever comes to your mind in regard to that. So in the meantime, let's move forward to our third presenter, Samuel Reinders. So Sam is a second-year PhD student. And his PhD focuses on exploring how new technologies and IT can be used to make information more accessible for vision impaired and blind people. And to achieve this, Sam combines 3D printing with low-cost electronics to create new and accessible conversational interfaces. Sam likens that a bit to Siri, and we certainly hope that it may have a similar impact one day for vision impaired people. So over to you, Sam.
Thank you, Bernd, and hello, everyone. So just as some quick background about myself, I studied computer science as an undergraduate student at Monash. Afterwards, I worked for a few years in industry as a software engineer, working in both private and government sectors. Whilst I enjoyed this work, it was at this point soon after that I realized that I really wanted to apply my skill set in order to help others. To do this, I enrolled back at Monash and undertook a honours program. And this involved completing a project developing an accessible interface to help low vision people learn introductory programming using haptic and auditory output. After completing this, it was obvious to me that I wanted to continue this sort of research as I found it extremely fulfilling. And so applying to the PhD program was the next natural step. I'd like to show a brief video summarizing some of my work involving my interactive accessible 3D models, which I'll just set up the screen share now. Hi, my name is Sam Reiners and I'm a PhD student at Monash University. My research area focuses on the creation of accessible graphics for people that are blind and low vision, using a combination of 3D printed models, as well as low-cost electronics and interactive interfaces in order to create accessible graphics that are both engaging and that enable independent access. Tactile graphics are generally used by people that are blind and low vision in order to access graphics, but graphics produced using these methods are limited as they cannot convey height or depth. 3D printing can help overcome these limitations, as content that is three-dimensional in nature can be produced. My work explores how these 3D printed models can be augmented with low-cost electronics to create graphics that are both more engaging and interactive. I'm currently prototyping a series of interactive 3D printed models that contain conversational interfaces, similar to Siri, Alexa, as well as the Google Assistant. One of my prototypes is that of the solar system. You can pick up the various planets of the solar system, you can explore them using your hands, you can trigger auditory labels using touch gestures, as well as ask the model questions. So the hope is that one day models like this will be found in many public spaces. Think of museums, art galleries, etc. And then in doing so, it will enable blind and low vision people access to graphical information that will help bridge equity gaps that they experience in everyday life. Undertaking my research at Monash has enabled me access to receive both mentorship as well as to collaborate with some of the world-leading researchers within the space. Additionally, Monash has some really good purpose-built spaces such as Sensi Lab, which contains specialist equipment such as 3D printers as well as laser cutters, without which I wouldn't be able to complete my research. Without a doubt, the highlight of my time at Monash has been the opportunity to get my research into the hands of end users, in this case blind people, and see the look of amazement on their faces as they interact with my models and access information that was previously inaccessible to them. All right, so some of the work that was summarized in the video was published earlier this year at the world's leading conference on human-computer interaction, CHI 2020. And this wouldn't have been possible without the support, the facilities, and the mentorship received from fellow PhD students, as well as researchers and my supervisors. And in the months to come, I look forward to getting my work into the hands of more participants and continuing to play a part in enabling improved access to graphical information for people that are blind and low vision. But that's all for me. Thanks for your time.
All right. Thank you, Sam. And we'll also come back to that at the end. And I'd just like to say, Sam just said that he'd just published his work at CHI, and you will probably not know this, but CHI is the world-leading conference on computer graphics. So to have a PhD project out there in the second year of your PhD at what is essentially the best place in the world to publish on this work is actually pretty amazing. But as amazing as it is, Sam's not the only of our PhD students who publishes there. So that is certainly something that working on a PhD here can get you to. We'll move on for now to our fourth and last panelist to present on their project, and that is Jigya Kabar. And I hope this goes all right because Jiggy is actually overseas. And so we may have to switch back to a local canned presentation, but hopefully it'll work all right. So Jigya works at the intersection of IT and social science, yet another field that's not core IT. Her research aims to study the cultural and social factors that shape and influence the use of information technology. To put it in Jigya's own words, the most significant challenge in making information, in managing information, are people and processes, not the technology. And Jigya's work aims to improve the management of these processes. So Jigya, over to you.
Hi, thank you, Bernd. Namaste from India. I'm Jigya. I'm a social researcher with the Faculty of IT. And after all those wonderful projects that my colleagues shared with you, the one thing that I think screams out loud is the multidisciplinary aspect that we have at research with arts, AI, 3D, engineering, and so much more. And with FIT, actually, information and technology and use in social good is very important as a vision statement in Monash. So my research is also interdisciplinary because I study the social sciences aspect of understanding information uses, sharing information as well as communicating the information from the perspective of human culture, which is already quite complicated. Yeah. So to understand this, I actually am using a qualitative research aspect for information practices of NGO workers and how do they go about doing their community work and taking care of culture and also using information to help the people that they want to provide the aid to. For this, I actually created a video to explain my research in 3 minutes in the 3MT competition, which I'd like to share with you right now.
Have you ever wondered if your access and use of information is determined by your culture? Let's delve into a short story of a Rohingya girl named Maabia living in the refugee camps of Bangladesh. When she started menstruating, neither she nor her mom had any information about maintaining clean and hygienic menstrual practices in a refugee situation. They couldn't approach any of the multiple NGO development workers visiting their camps every day since they were all men and their culture forbids such discussions with them. Women development workers were only accessible over 6 months later, and this lack of information from a culturally appropriate source resulted in Maabia and over 120 other females losing their lives over infections caused by poor menstrual hygiene. When we talk about society and people, culture and information are not mutually exclusive. I too am a child of refugees and I couldn't imagine losing my grandmother or my aunts over information that you and I take for granted. Quite simply, a basic fundamental human right. This story of Maabia tells us of the real world impact that culture has on information access and use. If access to information is one side of the coin, having a compromised autonomy in using such information is the other side, which extends significant challenges for the communities. My research aims to understand how cultural limitations and boundaries affect the use and communication of information. I do this by exploring the various layers of the information ecosystem of an international NGO Oxfam in the country of Bangladesh. My thesis uses accounts from 40 interviews of NGO workers conducted over last year as I shadowed them in their community development work, including their humanitarian relief efforts at the Rohingya refugee camps. And it is from their experiences that I create a narrative keeping cultural understanding as a focal point. From this data, I will identify a policy and intervention framework for NGO development workers on how the technical and cultural logics of information shape culture and are shaped by culture, in turn helping them aid the community better. My research will benefit the society by ensuring that dire consequences like Maabia's are prevented in every single instance where culture and information face off against each other. Thank you.
So this is my 3MT, which is explaining my thesis in 3 minutes, and it actually gives you a very comprehensive idea of how I started and why I started it. And this helps me because as a part of the Protic PhD group, Monash has provided me with access to people in the refugee situations which I wouldn't have access to otherwise. I can't just walk into a refugee camp and start asking people questions. So even for qualitative research, to have this understanding in a wide research angle actually helps you when you study with the university. Yeah. Thank you.
All right, thank you very much, Jigya. Yeah, extremely important work, and it really illustrates nicely that just generating a technical solution and putting it out into the world, well, that is a job only half done. It's an important part, but there's way more to do. So we now have quite a few questions coming through, and we don't have very much time. So I'll just pick some of those, and I will not pick the ones that are very sort of administrative questions, because I remind you, you can go to the booths afterwards, and we can answer all your questions there. So probably more the questions that directly address the panelists, namely the first one, what was your process actually for choosing your research topic? Do we have any takers for that? Yeah, Jiggy, go.
Oh, yeah.
Sorry.
Okay, so as I mentioned in my video as well, I'm a child of refugees, and this was something that was close to my heart. I could understand that there were problems that you face, because even though they're refugees, so my grandparents were refugees, and when they were involved in a situation, they still had to live their lives till their lives changed from the refugee situation. And I always wondered how the social aspects of that situation helped them, get out of it, maybe because they were declared stateless, and to get, citizenship. So I don't know, it kind of always mulled over. And when I was looking at doing my PhD, so my motivation actually came from a personal experience, at least that worked for me. And I designed my project based on how I would have understood that this research will help people. That was my motivation, because it would have helped me knowing such answers. And since I was from the social sciences background, that kind of fitted into this. But however, to get this over to the IT and have the interdisciplinary, so it's not just, IT is not only, as you mentioned, it's not technical, which is the fun part of IT, AI, technical, and creating something is the fun part. But there's also someone to be using that, at the end of the day. So that kind of guided me into understanding that I want to do this project, and it has to be in the faculty of IT.
Mm-hmm. Okay, Bhagya was also saying, if you can give us a short answer. We're sort of coming already to the end of our unfortunately short session. Bhagya.
Yeah. So my experience is very different from Jigya's, because I knew that I wanted to work with healthcare analytics using computer science and do analytics on healthcare. But my approach was to actually contact possible supervisors from Monash and see whether they have related projects. So fortunately, my supervisor got back to me saying that there is this project which is going to start soon, so you can join. So that's how I picked my research. Yeah.
Mm-hmm. So sometimes it's quite direct, the guidance, but not always, right? Okay. This leads us to another question I will ask, and really we need to come to an end, unfortunately, already. So really quick answers. Did you already know right from your undergraduate studies that you wanted to do a PhD? I see Nina smiling. I see Jigya saying no. Nina.
No, definitely not. I think it's a bit too far into the future to be able to predict that. But I think I always knew that it was like an option. But I personally started out in physics and then chose not to do a physics PhD, worked for a little bit and then came back to the whole PhD thing. For similar reasons as Sam's, basically just wanting to do more with technology rather than what I was doing at my company. So yeah, really it changes pretty year to year, I would say.
So indirect answer. Sam, do we know your answer? You've been working in industry in between. Was that a no?
Yeah, so yes, I worked in industry for a few years, and that kind of put things into perspective. Yeah.
So you see very different positions. Some were in industry, some were outside, trying something different, coming back, and others already were knowing from their undergraduate, yes, this is the pathway forward. So it's really not one size fits all. Okay. I'm sorry, because we're already going over time, so I need to finish this off here. I invite you again, join our booth at the V Fair, and all your questions will hopefully be answered there. Thank you again for joining us, and thank all the panelists very, very much for sharing your exciting projects with us. And we'll see you over at the booth.